Dr. Fisher here. We're going to go through our intern training video on our K laser. And this is one of two that we have. This one's a little bit more difficult to do because the screen's digital but doesn't have the pictures of the body, which is easy to pick and choose where you want to apply the laser to. So first thing is, always want to make sure it's plugged in, it's attached to here, and it's attached to the back of the units. And this one doesn't have a battery. It's always on, and it's a pretty powerful one, so we don't run off a battery. We always have to run off of power. So we make sure that we get all these things in there correctly, which we finally figured out how to do that. And then once you've got it set up, and right now we don't have our goggles with us, but we'll show you how to use it without them. But obviously when you start to apply the laser, you have goggles on yourself or the sunglasses on yourself and on the patient. So the very first thing is we push enter button for power. And it should power up. There we go. And our code key to get in is just 0, enter, 0, enter, 0, enter, 0, enter. And now push to select the area working. And you can see there's head and neck, shoulder and upper extremity, back region, hip and lower extremities, and then miscellaneous, which we can actually program ourselves. There's a manual setting we can program ourselves, okay? But we'll just pretend we're gonna work on the back. So then we push enter, then there's the thoracic or lumbar, sciatic pain, sacroiliac pain, thoracic pain. We'll say we'll go with lumbar. Then you just push enter. And now this is for either the continuous watt or constant laser, which may generate a little bit more heat. And this one is the I can't remember ISP is for, but it's a pulsating light, which is at a lower temperature and less watts. But we're going to go with the constant watt. Hit enter. There it is, telling you put your glass on, aim. Now it's all ready to go. So all you would do is you set it down, and then you would push the on button, and you'll hear it go through a sequence of beeps. And so each beep you want to keep moving it around, and you can lift it and move it, or you can slide it around if it's an easy area where it doesn't stick to the skin real well. Because if you do leave it in one spot for too long, you're going to feel it because it's going to burn, okay? Now, another great thing about this laser is we have a focal point here. Now watch, if you look at the focal point, this is all the way down at 1, and then see, you can turn it all the way up to 6, where there's more of a broader focal point. So you get a little larger area. So if it's a real pinpoint location, maybe in the shoulder or knee or somewhere, and you know where there's a small area of pain or injury, you can get more focused. But at the same time, when it is a smaller focal point, you got to make sure you move it and move it around enough. Okay, let's say this is the area. You want to make sure you move it far enough off of the point where you're going to concentrate the hardest, because if not, it'll generate too much heat for that one area, and it'll get hot. And you have to be obviously careful around tattoos or dark complected patients, because they'll absorb more heat and they'll generate heat in their skin a lot faster and much easier, okay? So what I typically do is I'll go beep, 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 and I'll go in a pattern where I know I'm concentrating the most amount of therapy on the spot that hurts the most, but I'm constantly moving it off of it, okay? So if you do little triangles or little circles or whatever, you're still concentrating the most amount of time on the area of injury, but you're giving it enough time to dissipate the heat, okay? It'll sequence all the way through it. It'll stop on its own, Okay? One thing that's really important about this laser is that when you're done, you want to sequence it out of here to turn it off. Okay? So let's say here, we're going to go therapy completed, and then we're going to go all the way back to here where it says off, and then press enter. So the machine turns off here. Do not unplug it, okay, because it will harm the laser itself on powering it on and off by just unplugging it, okay? Super simple, there you go.